Hello, my name is Kaylin and I am a clinical associate psychologist in training. I chose this role because I studied psychology in school at A level and it was my favourite subject. And I decided I wanted to try and have a career in this field. I ended up getting into this role by applying for university to do an undergraduate degree. And after that, I stayed on to do a master's degree in psychology as well. So I had those two degrees behind me, and I started to apply for jobs in psychology. So that was for assistant psychologist roles. And then I've worked in that role for a few years before getting on to the clinical associate psychologist training course. Benefits of working in this role are the amazing people you work with and support. It can be really, really satisfying to support someone with their mental health, particularly someone who's really struggling. And if you see that change in them where they're able to improve their mental health through working with them and supporting them on their way, that can be really, really satisfying. And you get to see some really nice stories of people really able to turn their lives around. And I absolutely love that part of the role. In terms of what a typical working day in this role looks like, you have clinic, so you're in a room in the hospital and people come in to see you, and that's the core of what you're doing. You're doing assessment and intervention, so you are assessing people when they come in. You see them for the first time, and you're trying to figure out what they're struggling with and why they're a bit stuck where they are at the moment with their mental health. And then once you've done an assessment and you've clarified how you're going to support the person, you then do the intervention, and that consists of working with them over an agreed upon time period, and really getting stuck into the problem and trying to work through it with them. In terms of the types of people you work with, so for professionals, you're going to be working with other psychologists. Where I'm working in primary care, you're going to be working with other therapists, and it's quite possible you'll be working with other types of mental health professionals as well, doctors, nurses, occupational therapists, but that'll be dependent on the service you work in. And in terms of patients, because we work in primary care, we're working with adults who are of working age, and obviously that's quite a wide scope of people. So you'll see people with anxiety, depression, with obsessive compulsive disorder, post-traumatic stress disorder, and it could be any kind of mental health problem really. Those are just the common ones you see in the role. I think it's important to be personable in the role. I think you have to be very reflective, so able to think about problems and think about how you might do things better and improve your own practice. I think it's important to be caring and compassionate for people. I think it's important to be emotionally intelligent, and also driven, because it's a challenging profession at times, and you need to be driven to get qualified and go through all the steps to get to the end point.